came downstairs and I said to my son, I said, I can't do this. I said, I don't know what's wrong. I just don't feel good. I'm going to go back and lay down. But I wasn't getting any better. And I said, something's wrong. When I called him, he was reading my blood work. And he said, Lisa, I see your blood work here. You have a blast. I need you to go to the emergency room right now. And that evening they came back and they told me, yes, you have leukemia. And I didn't hear it. My daughter was there. And she says, did you hear what he said, Mom? I said, what did he say? And she said, you have leukemia. And I just, from that point on, I was gone. I just was blank. I had no emotions. I had no feeling. I felt like I was just falling and couldn't catch myself. He says, Lisa, we gotta do a lot of testing. He says, yes, you have leukemia, but I don't know what kind of leukemia you have. Had I waited longer, I wouldn't be here because it was that aggressive. And they said, this is a process, so we got to get started right now and looking for you a donor, because for the simple fact that he says, I'm not trying to be funny or anything like that, but African American are very few. It could be difficult, and it could be where you're doing more rounds of chemo than I would like for you to do.
It all comes down to timing, right? So if you're a patient that has a leukemia and you're in the hospital and you're there for 4 weeks getting induction chemotherapy, that's lost time. Then you get out of the hospital and then you have to travel to Richmond. You have to see one of us. We have to type you. By the time we get the results back, I mean, you're talking 4-6 weeks now. That really is lost. So HLA Today sort of prevents that, right? As long as we have good communication with other physicians, have good processes in place, we can HLA type the patient when they're first diagnosed with leukemia, and we have that answer before they even leave the hospital. We know who their donor could be. So we save tremendous amounts of time that spares them additional rounds of chemotherapy and toxicity.
She was 100%. And that gave me hope at that point. I didn't want to put that burden on her. I didn't want to have to make her choose, and she didn't have to. When we got that okay that she could stay home and give, it was a relief for both of us.
The Related Donor Services has again cut down on the time to transplant for our patients because of the accessibility and the availability of their donor center nearby. You start really shaving off weeks when you start, adding in processes like HLA Today, and then you can get the patient's sister to donate in Illinois. Now, I mean, you might save 2 months in times of transplant, and that is a humongous savings in terms of time, because the risk of relapse with these leukemias, they often relapse early. Timing is very critical, so programs like HLA Today and Related Donor Services, these programs really expedite the process of getting patients to transplant, which in the end saves them. We require that they stay locally at VCU, and 70% of our transplants are from outside of our central Richmond location, so they need to be housed.
Lisa in particular, her situation was fairly significant because her only caregiver had to stop work to be her caregiver.
My husband's a truck driver and he's an owner operator, so if his truck doesn't move, we don't have any income. And he was with me from October all the way until April in Richmond.
They were trying to maintain a home because they had older children living there. So they could just shut that down and then also be here, pay for groceries and transportation.
But it was our source of income. Even though he was away, we were able to stay afloat with the grants that came through.
These grants and these funds are actually really saving their lives, because without them, they wouldn't be able to stay with us, and without that, we wouldn't be able to offer transplants. So in the end of it, it's really another one of those services that is really a life-saving measurement.
So things are looking up. I'm getting more stronger every day. It is a process, and I'm just looking forward to the future.